Hi, I'm Dr. Neeraj, MD Homeopathy, working as a Community Health Officer, National Health Mission, and also as a District Internal Assessor, NHSRC, NQAS, Telangana. I also have an experience of working with Dr. Jatin Walia sir as a sports physician for 5 years. And I'll be dealing with sports injury modules. And in the sports injury, today we'll be dealing with role of physiotherapy and taping techniques. In the previous sections of the modules, we discussed about muscle physiology and biomechanics, followed by sports injuries, and now we'll be dealing with role of physiotherapy and taping techniques. Role of physiotherapy and taping techniques. So far we have discussed about muscle physiology and biomechanics, followed by sports injuries, and now we'll be dealing with the role of physiotherapy and taping techniques. So the outline of this particular topic would have what is physiotherapy in the first instance, followed by common sports injuries and role of physiotherapy in those sports injuries, followed by injury prevention, injury assessment and diagnosis, sports injury recovery, functional rehabilitation, strengthening the muscles, preventing re-injury, individualized rehabilitation programs, importance of early intervention, prevention of sports injuries, advanced PT techniques, taping techniques, and lastly the summary. Now, what is physiotherapy? Physiotherapy or physical therapy is concerned with identifying and maximizing the quality of life and movement potential within the spheres of promotion, prevention, treatment, or intervention rehabilitation. It uses the physical forces which act on the human body and altering them to promote, maintain, restore physical, psychological, and social well-being, taking into account various aspects of the health status. Now, common sports injuries that we come across are muscle strain and sprain, overuse injuries, ligament tears, rotator cuff injuries, shoulder dislocation, concussion of the spine, stress fractures, eye and ear injuries. We have dealt in detail about all these sports injuries in the previous topic called as sports injuries. What is the role of physiotherapist in this particular sports injuries? Sports and exercise physiotherapists are involved in the prevention and management of injuries resulting from sport and exercise participation at all ages and at all levels of ability. Further, physiotherapists promote an active lifestyle to aid individuals in improving and maintaining their quality of life. When I say individuals, it means athletes or sports persons. Now let's discuss about injury prevention. Before that, we need to understand the role of biomechanics. We have dealt with the biomechanics in the previous topic. Biomechanics is very important, and its application to the movement of the human body and its understanding is very crucial for injury prevention. So biomechanical analysis helps in identifying improper movement patterns using video analysis and force plates assessments. Biomechanical analysis helps in correction of the posture, gait, and running mechanics of the athlete. The other aspect of injury prevention can be done by strength and conditioning. This helps in strengthening weak muscles and improving flexibility. Strength and conditioning is tailored to specific sports demands, example, endurance versus explosive power. In these two conditions, like endurance needs a different types of strength and conditioning, and explosive activities needs different strength and conditioning. Along with the aforementioned thing in the injury prevention, we also have something called as sport-specific training and neuromuscular control. Now, these helps in reduction of the risk of overuse injuries. It also helps in improving the proprioception, that is nothing but body awareness, and it helps in improving the reaction time. And this particular sport-specific training and neuromuscular control includes agility drills, plyometric exercises, and balance training. Now let's look into injury assessment and diagnosis. The role of physical therapist or a physiotherapist has changed from a mere technician following prescriptive orders to an independent healthcare professional with sound scientific knowledge and evidence-based practice. Physiotherapists do not provide a medical diagnosis but are well prepared to identify signs and symptoms outside the scope of physiotherapy practice and refer to a physician or specialist as appropriate. The focus of physical therapist is differential evaluation and the treatment of dysfunction rather than differential diagnosis and treatment of disease, as in the case of physicians. Sports person, which can be labeled as classification or diagnosis. Now let's look into post-injury recovery. Every injury